Good afternoon. So I had earlier said I was going to discuss something that happened with someone who follows my page, who reached out to me. So I'm not sure if she's patronized, so I wouldn't say she's a client, but something happened to her. She had thyroid issues, so she was having her thyroid gland was expanding, growing, and so they had to take it out. And it is a thyroid gland that releases thyroid hormones into the blood and regulates a lot of things in your body. But what happens when people have thyroid issues is more or less that the body produces some antibodies, which are thyroid antibodies, and they attack the thyroid gland. So when they are attacking the thyroid gland, they can destroy the thyroid gland and make it ineffective. And sometimes goiter can occur. And when there is goiter or this growth in the thyroid gland, it can affect a lot of things. It can, of course, affect your appearance. Okay, so usually they take out the thyroid gland. However, when they take out the thyroid gland, what happens is that there is no longer any thyroid gland to be producing thyroid hormones. And when that happens, your body still needs thyroid hormones. So they have to now place you on a form of thyroid hormone called T4 or Levothyroxine. Now, Levothyroxine is a thyroid hormone or thyroid drug that can be converted in your body to the active form, which is T3. So in her own case, because they took out the thyroid gland that produces T4, she has to be taking it orally, and of course a very high dose, which is about 100 milligrams a day. Now, what actually caused the thyroid problem were the thyroid antibodies, which were attacking her thyroid gland. All right, now when you remove the thyroid gland, those antibodies are still inside the blood circulating, and they can cause damage, but usually they attack the thyroid. However, a lot of these antibodies are linked to miscarriages. So there is a high correlation between miscarriages and having high levels of thyroid antibodies in your bloodstream. So that essentially was what happened to my client, despite the fact that she was using levothyroxine. So she was supplying her body with the thyroid hormones that she needed. However, there was still a miscarriage that happened. And she was asking me what went wrong, because she was very distraught. And usually when somebody comes to me that way, usually what I do is my mind is on their mental health or their emotional well-being. I'm not thinking about what happened. I'm more inclined to want to, find out how they're doing emotionally, find out how they are doing mentally. I'm more focused on their emotional well-being in situations like that. So I had to, sort of like calm her down. I didn't want to go into all this with her because the state in which she was at that time, it wasn't a good time for me to start telling her, oh, yes, start explaining all these things. So I asked her to just take things easy, take time off, heal from the trauma, because miscarriages are traumatic for women. Very, very traumatic, especially when the pregnancy has progressed to a certain stage, especially when you are bonding with the baby, you are feeling the heartbeat and all that. It's usually very devastating. So that's what I told her to do. However, this is the reason why it happened. Now, I spoke about when I mentioned this because I posted it on Threads, and I said, I was going to talk about the fact that there are things you can use to reduce thyroid antibodies. Now, one of the most effective ways you can reduce thyroid antibodies is with using black seed oil. Okay, so black seed oil, which contains thymoquinone actually has the ability to bring down your thyroid antibodies. There are scientific studies to show. So in situations like that, You see, and that's why a lot of times when people are dealing with things that have to do with fertility, it tends to get very complex or complicated. And it's not just, oh, I just had a miscarriage, what can you do to prevent miscarriages? You have to dig into what the problem is and try and troubleshoot what the problem might be. And it requires a lot of deep thinking and also a certain level of knowledge for you to be able to figure out what happened to the woman and how you can prevent it from happening further. Okay, so if you didn't know all these things, you wouldn't even link the thyroid issues to the miscarriage, except of course you're a medical doctor. But you know, for those of us that are herbal practitioners, most of people that do herbal medicine do not have that level of training to be able to figure that out. Okay, so the woman could go on continuing having miscarriages, and you're giving her generic herbs for miscarriage prevention, and it won't be working. Why? Because it is the thyroid antibodies in her blood that are causing the miscarriage. So that's why, for me, I treat fertility issues or women coming to me on an individual basis. I do not do one size fits all. Okay? Yeah. And that is the only way you can have success. And, you know, it does take time. It does take it's not easy for somebody to come and tell you, I'm having miscarriages, give me treatment for miscarriages. And then you start digging into the reason why it happened, trying to figure out why. It's easier for somebody to just come and say, I'm having miscarriages, give me herbs. And I'll just say, oh, I have herbs for miscarriage, sell. You see? So that's why my manager says it. She says, oh, that if we were just selling shoe and bag, we'll be making a lot of sales, because we don't have to go this complicated route of speaking to the person, troubleshooting, trying to figure out what's going on and all that. Yeah. So this is a free tip on how to handle that kind of case.